So cystic fibrosis is a genetic disorder, so you have to have one abnormal copy of the gene from your mom and one from your dad, but it's rare, so there are less than 200,000 people in the country, and that's what qualifies it as an orphan disease. In fact, at this point, there are about 40,000 people in the US and probably around 90 to 100,000 worldwide, so it is fairly rare. Now, every state does actually do newborn screening to test for cystic fibrosis, but that really has only been recently in some states. And the way newborn screening is done, it does miss some people, especially people who are Black, Indigenous, or people of color. So up until 2012, all of the drugs that we used to treat people with cystic fibrosis were for the signs and symptoms. So for example, there's a drug called Dornase alpha that people inhale and it breaks out the thick, sticky mucus in their lungs. We never had a drug that actually impacted the basic problem with CF. And then in 2012, a drug was approved that actually did improve people's lung function, decrease how many times they had to go to the hospital, but it was only for a small portion of people, about 4%. More recently, I was involved as the primary investigator and on the steering committee to develop the clinical trials for a drug called elexacaftor, tezacaftor, ivacaftor, or Trikafta. And because it works on the most common mutation, it's actually available for people in the United States who have one copy of F508del, and that covers about 90% of people with cystic fibrosis. So it's really a game-changing medication because, again, people's lung function got better, their weight went up, they had less pulmonary exacerbations, so they had to go to the hospital a lot less. Their energy is so much better. People say their sleep is better. It really was life-changing. When cystic fibrosis was first described back in the 1930s, people died before they went to kindergarten. And as we developed therapies specific for CF, people started to live longer and longer. But even for people like Sam and Libby, when they were born, the average life expectancy was still less than 30 years of age. Now, as of the 2021 Cystic Fibrosis Foundation patient registry data, we actually have a median predicted survival of 53 years for people with cystic fibrosis. So it has changed dramatically in a very short period of time because of these life-changing medications. So we definitely are not done with cystic fibrosis treatment. So I told you that about 90% of people are eligible for these medications. We still need to get it approved down to younger ages. Ideally, someone would get diagnosed with CF and then start on these medications right away. And we're not quite there yet. But more importantly, there are people who are not eligible at all because of the specific mutations that they have. And so we need to develop other therapies for those people both who cannot take them because they're ineligible for their mutations or because they have side effects from the medications that are just intolerable. So really where we're headed next is gene therapy. So we are actually starting a gene therapy trial here at National Jewish. I'm the national primary investigator for this study, and it's already enrolled several patients. And so what we want to do is replace the gene that's faulty with one that tells the cell to make the correct message. And so I really think that's the future of where we need to go with cystic fibrosis treatment.